Hello, everyone, and welcome to our 10th episode of the Yoga Meets Movement Science podcast. Today, we're going to be talking all about the benefits of strength relative to pain. So, what do we know about the benefits? When do we sometimes maybe take these things too far and think of strength as a cure-all for pain? And what are some of the questions that we still have surrounding the relationship between strength and pain? What do we still need to learn more about? So to help us talk about this topic, we have invited a very special guest, and this guest is Adam Meakins. One of the reasons that we asked Adam to be on this episode with us is that he is a huge proponent of he's a huge proponent of strength. Not a huge proponent of pain, but he talks about pain. And he actually has a motto that says, "You can't go wrong getting strong." So Adam is a physiotherapist, or as we refer to it, a physical therapist in the US. He's a sports scientist, a strength and conditioning coach, working in the NHS, National Health Service, and private practice in the United Kingdom. He has a popular shoulder course called The Painful Shoulder. Complex does not equal complicated. And he is widely recognized for calling out BS in the physio and movement worlds. And from what I have seen, very influential, especially for up-and-comers in the rehab world, often cite him as one of their top influences. And he's really out there putting out great information on social media, and we think he's awesome. So welcome, Adam, to the podcast.
Wow, thank you very much for that glowing introduction. I feel quite embarrassed now. I've got a little bit of a rosy glow to my cheeks. So thank you very much for that, Travis and Jenni. It's a privilege to be here. Thanks for inviting me on to talk all things in around pain and strength and rehabilitation. Looking forward to it.
Yay, we're so happy to have you here. Thank you, Adam. And we thought that we might just start off by just establishing like a base definition for the term that we're throwing around here today, which is strength. Would you be able to just define for us before we get into it too much? Like what does strength mean?
Oh, great question. And one that's probably got about 33 different answers based on who you talk to. So probably a quick, simple way to create an argument between physios and strength and conditioning coaches and personal trainers is to ask that question, because I'm sure you're going to get lots of disagreement. So for me, I think, from a term strength, it basically means a force output. So I think we're discussing when we say somebody has strength or they are looking to assess their strength, we're looking to assess their ability to produce force. And that ability to produce force has physiological factors, but also psychological factors as well, which I think sometimes is not well recognized. So we definitely know that, muscle power, muscle size and other physiological parameters contribute to the development of force output, strength, but so do other factors as well. So, the willingness to do it is also another factor we have to consider. The psychological factors, the fear, the pain as well. These all sometimes, again, influence somebody's strength. But yeah, it's a great question. So for me, strength basically is somebody's ability to produce force.
Thank you. That's such an excellent and thorough answer. And it's good for us to realize there's not just a factor of how much force a muscle can produce, but it's influenced by other factors as well. And psychology, that's a huge one to point out. Thank you. Would you say that, so if that's strength, would you say that strengthening would be increasing one's ability to produce force by any number of mechanisms?
Yeah, so again, by definition, we use the term strengthening exercises to imply that we are trying to produce somebody to be able to produce more force. But what we often find, particularly in some rehab, in fact, a lot of the rehab, is that when we use this term strengthening exercise, we don't actually see changes in force output. People feel better from doing it, but they don't actually see changes in their force output. So again, I think this term strengthening exercises in some situations would be better off described as resistance exercises. We're using resistance in the form of an activity or a task or a movement but it doesn't necessarily change their ability to produce force. So I think, we use these terms interchangeably, but I try to determine the difference. Is my goal here to try and increase force? Then I would try to say this is a strengthening exercise, of which I think certain parameters have to be met or achieved to try and achieve that. But then there's other times where we're using resistance exercises, which are sometimes considered to be strengthening exercises, where we're using the same looking type of exercises, but we're not actually thinking or needing to try and improve somebody's force output, their strength. And
that's
again,
a nice
it may be,
distinction.
a little bit of semantics, I think, a little bit around it sometimes. But I think it's important.
if you're being intentional about it and saying, well, if we're doing strength training, then we're meeting certain parameters in terms of it being hard and it being heavy and it, going to a certain level of exertion. But you could use the same exercise and it be lighter, or you could be not going into as much effort. And so it's whatever outcome we're trying to get at in that moment or over the term of using that can vary which sort of way you're referring to it with someone.
Absolutely. I think the key parameter there with defining what's the difference between a strengthening exercise and a resistance-based exercise would be the intensity. It would be the perceived effort rate in there that normally is the factor that, when you look at the research, seems to be the one that has the more importance when it comes to trying to get people stronger. It's not so much about the loads that we're using. It's not so much even about the sets and the rep ranges. It has tend to be the intensity, or the perception of intensity is the thing that does or doesn't actually change people's strength. So I think that's the factor that needs to be looked at the most when trying to determine, is this a strengthening exercise? And if I'm being honest, I think that's the one factor that a lot of, especially rehab professionals, don't actually look at. We get very focused on the sets and the reps and the frequency and how many times you need to do it. We don't actually tend to focus too much on the intensity perception of the exercise, which I think is the far more important variable.
And that's an education process too, because some people, especially people who are newer to resistance or strength training, people who are in pain, their perception of hard it's not, I don't want to say wrong, but it's different. They might feel something is hard where you say that's a 5-pound dumbbell that objectively couldn't feel hard, but their levels are all off.
Absolutely. Effort is the perception of intensity is governed by so many different variables based on the individual circumstances, and everything else that's going on around it. And again, a little bit of that old school bro science is, you can't get strong if you don't start using heavy weights. You've got to have heavy loads to get strong. We know that's not true at all. We know that you can create muscle hypertrophy and strength gains with all the variations of load. It's the intensity of that load that's far more important. Yeah.
So you could use a lighter load, but just do more reps to get yourself, like, at the end of that set. If you feel that intensity toward the end, then you're there, and it's a lighter load. But that's why the intensity is the factor that, like, it has
Absolutely,
to be
it's
hard
the key
at some
factor.
point.
Yeah, we do see that sort of, zone of creating adaptation does feel challenging, does feel hard, does feel intense. And that seems to be the factor that we see most often commonly improves strength or force output, is when the intensity is at a certain specific level. But again, it's still a bit of a grey area, and it's something that I still struggle with. Was that, well, how much or how high does that intensity have to be to actually still see changes in strength? And again, it's variable based, I think, on individual factors. So, I think we see novices and people that haven't had much experience or exposure to resistance training. We see that they can perhaps create quite a lot of strength adaptations without actually having to push that hard into intensity. Yet somebody who's been exposed to intense exercises and resistance-based exercises for a bit longer probably has to push harder into intensity to get those same adaptations. So again, there's other confounders and variables there, which means that, again, when it comes to prescribing and dosing exercises, there is no one-size-fits-all approach. This 3 times 10 or 5 times 5, parameters that I often see being promoted as the best to use. It's just not that simple.
So the answer is to take like 2 years off and just do nothing. So then when you go back to it, you can get a lot of adaptation. Right?
Well, it's funny you should say this, because when I see people a lot in my role as a rehab professional, healthcare professional, and I am trying to promote the benefits of resistance-based, strength-based training, and I'm dealing with somebody who's never done it in their life, you know, and they're really fearful and they're really anxious and they're really worried. I'm like trying to put all the positives on. I'm saying, look, you've got so much potential for adaptation here. You do not realise the potential you have of creating changes really quickly and potentially quite easily because you've never been exposed to this stuff. Yes, where somebody that has been training for, 10 or 15 years, it's a lot harder for them to get the same adaptations than a novice. So I use this as a positive for this novice person.
I love that, yeah.
And try and say to them, just the potential in front of you is just awesome, and let's explore it. Let's use it to our advantage, because your body is just going to lap up all this stimulus that it's never had before, and it's going to create all these positive adaptations that is just going to open a whole new world of opportunities for you. So I actually use that as a positive rather than a negative for novices, and say to them, it's a really nice, useful strategy I find to try and get them to buy into engaging with resistance exercises, to say to them, you've got this option to go into places that you've never been before.
That's something that I wanted to ask. Like, do you encounter, so obviously there are a lot of people who you see who've never done it before. Do you encounter resistance to resistance exercise? And when you do, is it something that you try to reframe? So instead of we're doing squats, we're doing sit to stand, and is it sometimes, so that one example, I guess, would be, okay, we're going to try to work around this by changing how we're referring to it or changing your conception of it. And the other thing would be, are there just sometimes people who say, I don't want to do it? And then what would you do?
Yeah, great questions. And again, yes, there is a lot of resistance to resistance-based exercises based on society and cultural factors, but also because of a lot of negative misinformation, misguided information about the risk and the dangers and the harms that can come from resistance-based exercises. There's this big cultural push that if you do these resistance-based exercises, the risk of injury is so high compared to doing non-resistance-based injuries. And again, I try to flip that around, and sometimes I discuss the research about the thousands of hours of exposure and the risks of injuries in those thousands of hours. So normally when we talk about injury risk, we look at thousands of hours of exposure, and then we normally get a figure to see how many, what high risk potential there is of 1,000 hours of exposure of this particular task. What are the chances of you having an injury? And resistance-based training, strength-based training, traditionally, consistently, always goes to the bottom of the list when you look at the amount of injuries per 1,000 hours of, say, doing running, cycling, swimming, all these other tasks and exercises, even, things like probably yoga and other exercises, tennis, football games, rugby games, soccer, all these sort of tasks. These all have far, far higher injury risk profiles compared to resistance and strength training. So I try to help people understand that a little bit, reframe that a little bit. And then the other thing that you mentioned there, Travis, yeah, absolutely. It's a case of reframing what resistance-based exercises is. It's not gym culture. It's not just about, bros in... Absolutely, Jenny. They always go around thinking, if I'm doing resistance exercises, I'm going to have to go into a sweaty, smelly gym with guys on steroids, with their little string vests on, doing the old double swan poses in front of the mirrors again. And I totally get that. Puts me off. And I'm the guy normally doing the double swan poses in front of the mirror as well. So I understand gym culture absolutely puts a load of people off, but I try to reframe that, resistance-based exercises isn't just gym culture. It's not done with iron plates in machines, in gyms with music blaring. You can do it in so many other ways. Like you guys have been trying to, incorporate and reframing it as well. I had the classic one I had not so long ago. I had a lady that was struggling with back pain, who I wanted to use resistance-based exercises to help improve her capacity around her back and her hips, to help her do the thing that she couldn't do, which was a main thing she wanted to get back, was picking her grandchildren up. So I reframed deadlifts as grandchildren picker-uppers.
I love that.
Amazing.
Your deadlifts are now called grandchildren lifts. Yeah, that's it. Job done. And there was that got the buy-in. She was like, she could understand now why she had to do this type of task because it replicated what she needed to be doing.
That's exactly with our strength training for yoga book. We have this section where we show the relationship between a deadlift and a halfway lift in yoga, and showing that this strength exercise looks a hell of a lot like this yoga pose. It creates that conceptual framework for, I see why that exercise, why adding load to that exercise would help me feel more easeful in my yoga practice or in my day-to-day picking my grandchildren up. So when you call it like deadlift, that sounds scary. I'm going to hurt myself. There are connotations. There's dead in the name, right? Yeah. Which that's not why it's called that. It's called that because you're picking up a stationary object that's a dead weight. But
dead weight,
yeah, so people have different conceptions. And so like you said, if you can educate people, the science shows that this is no more dangerous than the other things that you maybe already do or think of as generally safe, running, yoga, whatever else. And certainly much less risky than some of these contact sports, right?
Absolutely. Yeah, it's strange, I think, how some of these names in resistance-based strengthening exercises do have horrendous sort of internal images and perceptions. You know, they do like to give them these big scary names,
Skull
which again
crusher,
puts people off. Skull crushers, yeah, deadlifts.
The variation of the Nordic called a razor curl.
Yeah.
So instead of going all the way out, you kind of hinge at the hips and go out and in. I don't know why they call it a razor curl, but that's kind of a scary name.
It does, yeah.
It also is a scary exercise just because it's so hard. Maybe that's why they call it that. But.
Yeah, it doesn't give you sort of that willingness to think, I'm going to rush in and try these skull crushers and razor curls. Yeah.
It's making me think about how, so I'm a yoga teacher and not a physio or a therapy professional at all, but I've tuned in quite a bit to the physiotherapy culture. And I think that I kind of came into like learning from like people like you and these other evidence-based physios and physical therapists. And I got this impression that all physical therapists are really into strength and prescribing strength training to their clients. Like I just thought, because I think all of what people I was tuning into do.
Because Adam's the loudest, so that must be what's going on. You know.
Right, I just didn't realize. And I remember I went to this seminar with Scott Morrison. That was it was all PTs, and I like got special permission to go, and I was really intimidated to go because I was like just this yoga teacher in this room full of PTs, and I just felt like they'd be so much more knowledgeable than I was. And then he had us do like this breakout exercise with a partner exercise, and we were supposed to teach each other a single leg deadlift. And the PT who I was partnered with, I was like, okay, let's teach the single leg deadlift, and he asked, what's a single leg deadlift? Like he didn't know. And for me in that moment, I was just like, that actually makes me feel a little more knowledgeable, and I'm not a PT. But anyway, it was just like a moment of realizing that I guess strength is not like a widespread value or a widespread prescribed intervention among physical therapists, even though it's so great.
No, Jenny, you're right there. It's something that I have been, over the last 20 years of my physio career, trying to improve and turn around, and hence why I'm quite loud and noisy about it. And that's probably why you did get that perception that physios are all into strength. But no, the vast majority of physios are not actually taught about resistance or exercise prescription very well at all. You know, it's all about, manual therapy, pain modulation, and all these types of treatments for pain, rather than looking at exercises. And when they do get taught exercises, they get taught the more motor control type paradigm of exercises, about the need to do exercises very specifically, about the need to do them in specific ways to activate specific muscles. And I find, again, that paradigm doesn't tend to help people much. I tend to find there are issues with that sort of motor control rehabilitation type approach, because it overcomplicates things, totally unnecessary. I think some of the explanations around it can be quite fear-inducing and worrying for people. And I sometimes find it actually creates more barriers to engagement with the exercises, rather than actually what it should be doing, which is encouraging people to move more. They have to focus, on doing it exactly the right way. If they don't do it exactly the right way, there's no point in doing it at all. And I just think that's nonsense. And again, it's just, I don't blame physios too much for doing it. It's because it's what they get taught. But I'm hoping that we're slowly beginning to realise is that these exercises that we believe are doing things like, keeping things in alignment, and they're getting the sequencing of the muscles to work in the proper way and the proper organization, is probably unlikely the reason why they help people. I still like these lower intensity based motor control exercises without these narratives around it, because they are just lower intensity exercises. Once you strip away all the confusion and the complexity and the harmful narratives around them, they're great exercises. They're nice, simple, entry, low intensity movements. You just got to take away all the rubbish around it that can actually create more problems rather than assistance for people. So yeah, I find physio is very much still trying to shift away from that motor control based exercise paradigm towards the more simple strength and conditioning world. It is getting there, it's slow, but I will also say again, I'm quite open and honest and say there's a lot of complexity and unnecessary explanations around strength and conditioning as well. And you see the strength and conditioning community beginning to realize that it doesn't matter so much about, your set parameters, your periodizations, your techniques as well. All these things are beginning to be seen to be superfluous and probably not as important as we were thinking when it comes to helping improve people's performance and their strength.
That's so interesting. So even maybe in the strength and conditioning world, there can be a tendency toward things need to be done in a super specific way. Absolutely. That are better than other methods. And it sounds like it might just kind of come down to being a little more simple than that.
Yep.
Yeah. Like you say, like the title of your shoulder course is like, right. Complex doesn't mean complicated. Like it can be a simple approach to still initiate complex processes within the body, but maybe we don't need to be so specific. Yeah. So I feel like we've done a good job of kind of establishing how valuable we all think strength is. But I'm just wondering a little bit about if maybe because I know all three of us are skeptical thinkers who like to question biases. And I'm just wondering if we could talk a bit about some limitations as far as strength. And I know that's a little bit of a complex question because that could be strength in terms of rehab, like helping someone in pain. It could be strength in terms of preventing pain. There are just, different parameters that we could go to with that. But in general, I guess I'll be more specific. So like within rehab, within what you do as a physio, where could strength have limitations?
Well, the biggest limitation is pain, really. So whenever you're using it or seeing somebody in pain, we've got to recognise their ability to produce force and to be strong is inhibited. It's going to be affected by their perceptions and sensations of pain. And so I do think that, using strength and conditioning principles in these environments with people with pain is a limitation. So trying to get people strong with pain, I don't think can be done the same way as trying to get people strong to help improve their performance. So, rehabbing somebody with 6 months of non-specific low back pain using resistance-based exercises is going to be completely different than the parameters you'd be using to help rehab someone 6 months after an ACL reconstruction. Because that ACL reconstruction after their surgery now hasn't got any pain. They've recovered from their operation. You're looking to build their performance up to get them back into being able to run around a football pitch, jump, turn, cut, twist, etc. Whereas somebody with 6 months of non-specific back pain has still got back pain, has still got probably other associated fears and anxieties around the pain as well. So we're going to still use resistance-based exercises there, but they're going to be looking completely different than we would do when we're dealing with somebody with that ACL. So again, I think, as much as I am a fan of using strength and conditioning principles in physiotherapy, when you're using pain, or you're seeing somebody with pain, you have to take that into consideration. And so this dosing of intensity now becomes very challenging. And the thing I like to do is whenever you are trying to dose exercises with pain, and I keep it very simple, I call it a rule of 10. And the rule of 10 simply implies that when you're adding up somebody's intensity of an exercise plus their pain scores, if they're roughly around 10, you're not going to go too far off mark. And basically it means that when somebody has high levels of pain, and we normally use that scale of 1 to 10, when somebody has pain at 7 or 8 on the pain score, that only leaves you 1 or 2 points on their exercise intensity score to keep to that rule of 10. So simply put, high intensity pain, low intensity exercises. And then if you take that down to the other end of the spectrum, somebody comes in with very low intensity of pain, so they're rating their pain about 1 or 2 out of 10. That now gives you up to 8 or 9 on their exercise intensity score to play around with. And I normally find, say, if you follow that rule of 10, it means that you're probably not going to be pushing somebody too hard, too quickly in those painful situations, keeping those exercises at a sufficient intensity that will hopefully create some positive adaptations.
That is such a great and simple formula that like anybody can use. I feel like you're really good at offering really simple ways for people to think about this, but I love that kind of adding up to 10.
The rule of 10, it does work well, and it's not rocket science. Not rocket science.
Right, it doesn't have to be, but it seems like sometimes we all get a little attached to things, like wanting it to be like rocket science. It doesn't have to be. Totally get that.
Yeah.
So when you're trying to keep the intensity on the lower end of that because pain is on board, are you shifting more towards, so it sounds like on the continuum of resistance training to strength training, it's more towards the side of resistance training. Are there other sorts of interventions? You mentioned motor control, or maybe just the one that comes to mind is, well, we can walk, right? Like maybe that's the prescription in that moment because that's not too strenuous for the person. They're able to do it even with the pain. Like how does the focus change when there is a lot of pain initially?
So another simple saying I have lots of simple sayings, but another one I say is the best rehab exercise is the one that's getting done. So, when it comes to choosing, what's the best thing to be done, I need to make sure that the person is able to do it. So again, there's other barriers to rehab exercises in pain, is that sometimes people just don't want to do it because they don't see any meaning in it. They don't enjoy doing it. They don't see any sort of value in doing it. They haven't got the equipment to do it. They haven't got the time to do it as well. So all these variables also have to be taken into consideration. So there's no point in working out a kick-ass strength and conditioning program that's got all these parameters and it requires all this equipment when somebody goes back home and they've got no access to that at all. And, they're coming from a low economical background. They can't afford gym memberships and all this sort of things. So then we're going to have to think about other ways and means of trying to get people to do something else instead. So, yeah, we have to take into consideration the individual and their preferences and their situations and their environments into consideration about which type of exercises we do. So, low intensity exercises can be, with lots of fancy equipment, and you can have your Pilates, bloody reformer tables and all those sort of things. You can do low intensity exercises on that if somebody values yoga, that, if somebody really enjoys, and yoga, and all the other sort of stuff. If people really attach to that and they really enjoy doing it and they've got the equipment, great. Yeah, I'd utilize that to my advantage. But then they've also got to consider there's other people who don't enjoy those sort of things. They've got no access to these equipments, and we're going to have to find a much more simpler approach, which, as you said, Travis, walking is a nice option there. Simple floor-based exercises or something along those lines can fit quite nicely into those situations. But again, you've got to try and give it meaning to the patients as well. And again, I do find a lot of the time, if we're just giving out rehab exercises without explaining the meaning behind it or attaching it to a meaning, they often don't tend to get done because people don't understand why or can't see why they need to do them. So I always like to try and find the hook as well. Is find out what the patient's real desire and goal and motivation is. What's the one thing they want to do? And then try and fit the rehab around that. And as you say, trying to make the exercises look like the task they want to do. And I find that can be, again, a nice hook for somebody to understand, okay, that's going to keep me motivated. We talk about motivation quite a lot. Motivation can be quite short-lasting unless it's attached to something meaningful. So again, if you've tried, I'm sure you have, to engage in a fitness program or lose a bit of weight, our motivation starts off very high at the beginning, but unless we've got actually something that we're attaching a meaning to it, that motivation doesn't last long. So we've got to try and keep people going there.
Yeah, the kind of way that you could conceptualize that is if you have some sort of weight loss goal or some sort of even a performance oriented goal, that's sort of like extrinsic, it's outcome based, it's kind of fleeting. But if you can find something intrinsically that you enjoy that and you find meaning in, that, it's probably more likely to bring you back day after day, week after week, even after that original extrinsic motivator kind of waxes and wanes.
Absolutely.
More sustainable that way.
Absolutely.
So you've defined strength for us as force production, and that's kind of made up of multiple mechanisms that can influence that. We know that strength type exercises in general can be helpful for pain in a rehab context, in the right context, as we've kind of outlined. But when strength is helpful, is it necessarily helpful specifically because it increases force, the ability to produce force? Can there also be other factors going on?
Yeah, absolutely. So the mechanisms of why resistance-based or strength-based exercises help reduce the perceptions or sensations of pain is still not well understood. And that's because there are multiple reasons or factors that can be contributing to that perception of change. So there is no doubt that, there can be physiological adaptations that can account for that. So, muscle hypertrophy, tissue adaptation changes, neurophysiological adaptations, etc. But there could also be psychological and cognitive explanations as well. So I do find that, resistance-based exercises and strength-based exercises can help improve people's perceptions of robustness and resilience. And it can help reduce fears and anxieties, and that can actually be a mediator of helping them feel better and less pain. So sometimes, some of these resistance-based exercises where we think we're creating physiological adaptations to help people with their problems may actually just be confronting their fears and their expectations and challenging those and changing those at a, psychological level. And that is then changing their perceptions of pain, because pain is a bloody weird phenomenon. Pain is influenced and factored by so many different variables. So trying to work out or tease out, when we give an exercise or resistance-based, strength-based exercises to somebody who's got a problem, who's got a disability, who's got pain, and we see it helping them, trying to tease out how that's helped them, that is a very challenging question to answer definitively. And it's quite challenging to me because, based on my old school thinking, when I had it a few years ago, I was very much focused on the physiological adaptation. So I very much had that belief that that's what we were doing. But I've realised and read a bit more around it now and realised it just isn't that simple.
So with that in mind, are there I guess it kind of ties back to what we said earlier, resistance-based exercise versus strength or strengthening exercises. There might be situations where you look at it and say, I think it's going to be enough just to do some resistance exercise without expecting this person's strength to increase over the duration of the rehab program. And maybe other times you say, well, this person, I think maybe there was a mechanism of injury that kind of showed that their strength was actually a limiting factor here. So maybe we do actually want to make sure that in 4 to 6 to 8 weeks, they've actually truly gotten stronger so we can try to reduce the risk of that happening again. Like a, hamstring strain, maybe that would be a good example where we have some better evidence to suggest that strength here actually is a predisposing factor.
Yeah, absolutely. I think there are times where deconditioning and trauma and injury absolutely, will have a negative physiological effect on somebody's ability to produce force, absolutely. And so, using our exercises to try and rectify that, yeah, absolutely. But then there's times where their pain and their other issues are probably not affecting their physiology, and it's other things, it's pain inhibition. That's preventing them from producing force, and that pain inhibition is because they're fearful or scared or doing something and they don't want to do it, or they're unwilling to do it, and therefore we're challenging those notions and those expectations, and that sometimes is what helps people feel stronger. Yeah.
So kind of on the flip side of this topic, so we know strength is complex. There's a narrative out there that I'm pretty sure you're familiar with, Adam, but this idea that when people have weak muscles, or just when they're weak in general, that can be a reason that they have pain, or that can be a risk factor for pain, like weak muscles can cause pain. Do you think it's as simple as that?
If you probably had talked to me about 5 years or so ago, I'd have probably said yes. But again, through my process of evolution, I'm beginning to realise it's not that simple. So yeah, being weak is not a sole factor for any pain or pathology, because all pains and pathologies are multifactorial. And so, we can't just use reductionist thinking and blame one sole factor for that. And that goes for anything else. I hear the term, it's just because you're old. Your age, that's why you've got these pains, that's why you've got that problem. I'm like, well, again, it's not that simple, because there's people at the same age, if not older, that don't have these aches and pains that you have. So there again, totally. Just this reductionist thinking around why people have pain and discomfort has to change. We have to look at it as a multifactorial phenomenon. But that's not to say that weakness or lack or deconditioning doesn't have any role to play in people's problems, because I do think it does. And we are in a world that is decreasing in its activity levels. We are in a world that is becoming more sedentary. And as a consequence of that, we are seeing increasing rates of problems and pathologies because of that. And we know we've got pretty good, robust evidence out there to show that sarcopenia, which is basically a muscle mass loss, is a key driver of many other pathologies and many other disabilities that are associated with pain. So, although we can't blame pain, weakness in isolation for pain, we can say that if you lose muscle mass, you have sarcopenia, it increases your risks of having more pathologies and conditions that are often associated with pain and disability. So it's a little bit of a circular sort of reasoning to get there, but there is, again, some quite robust evidence that does show that, this sedentariness, lack of engagement with resistance-based physical activity does lead us to have increased risk of having pathologies and pains, absolutely. But it's not just that simple.
That's such a great big picture answer. And my understanding, and correct me if I'm wrong, but is that sarcopenia, or that loss of muscle mass, especially as people get older, is often correlated with loss of bone density, or osteopenia or osteoporosis. Like I think there's even a term, I can't remember it right now, but it's a term that combines those two because they so often occur together. And so it just makes sense that strength training would directly combat that, not only on the muscle level, but also the bone health level.
Yeah, I think what we're seeing here, as I say, is these things are obviously secondary side effects of deconditioning, of lack of movement, lack of activity often, or some other disease-related condition that can be affecting the pathways for muscle synthesis and bone synthesis as well. But yeah, I do think, we see, not just people, normally when you have sarcopenia, there are other associated issues around it as well, yeah.
So
the one that we hear the most often from, that I hear a lot of times with people coming to me, they're finishing up rehab for back pain, or they've had it historically, and they say, oh yeah, the physio told me it was because I had a weak core, and so they come to me and they're wanting to strengthen the core, like that's their primary focus. And I guess my question for you is, like, when I'm sure you've encountered that before, people coming from other providers, how do you address that narrative? And also, is it not to say that core strengthening couldn't help? Is that part of the program, or how do you tackle that?
So again, it depends on what the understanding is around why they need to do these particular exercises. If there's negative beliefs and there's negative understanding and there's misinformation, then yes, I'm discussing it and I'm correcting it. But if there is, understanding that it is part of the picture and it's not the only factor, then I'm quite happy for them to think that they need to do these core exercises to help their problems. So, it's not that I would challenge or explain to everybody that I see that these core exercises aren't going to help or they won't help. It's about understanding the individual and what they understand by why they're doing them and what the possibility is of them helping or not. But yeah, there's a lot of, I think when say there's this reductionist approach to exercise a lot of the time when we're helping people with pain and pathology. We say to people that this is going to help because of this. And it's normally just one thing. Right. It's normally because we're going to stabilize your spine or we're going to, improve your muscle mass. And that's just one factor out of probably another 23 or even probably 223 different other reasons as to why these exercises could also help somebody feel better. It's not just about the improvement in their muscle mass. It could be due to the changes in their metabolic pathways. It could be due to their blood marker changes, their chronic low-grade inflammatory factors improving, because we see that occurring with resistance-based exercises. It could be due to their changes in perceptions of fragility. It could be improving their confidence. It could be improving their sleep quality as well. All these other variables that this exercise could be helping somebody feel better. It's not just based on one thing in isolation. And trying to get that message across isn't easy.
The funny thing too is, like with back pain, for example, they say, "Oh, well, you're having back pain because your core is weak." But then there's this other paradigm called regional interdependence that says, "Oh, well, we need if the back pain is the weak core, then we're going to train the spine or the core or the torso or whatever, that localized area." But then there's this other school of thought that says, well, it's never the site of the pain that's the problem. It's the above and below, the neighboring joints, or maybe even very distal, far away joints. Your big toe is the cause of your neck pain. And it's not, so like regional interdependence, it's fine. It's not like you shouldn't address other body parts, but it's kind of funny when we think about, you need to mobilize your hip because you're having instability of the spine and that's causing your back pain. Or we need to free up your upper back so that your lower back doesn't have to move as much. And it's like, it goes back to what you said, like these nitty gritty explanations of why these phenomena are occurring when there's, like you said, 223 other potential explanations.
Yep. A good friend of mine, Eric Mira, says there's always an alternative hypothesis. So whatever hypothesis you have as to why something is helping, there's always alternative hypotheses. And your role as a critical thinker
you can think about that. Oh, sorry.
No, you're right. You could think about that in anything, in everything that we do, that we encounter. There's always other reasons as to why, I'm having a bad day today. I thought it was because I got out on the left-hand side of the bed instead of the right-hand side of the bed. But there's also other factors that why you're having a bad day as well. So, yeah, there's always alternative hypotheses, Travis. And that interregional interdependence, or whatever it is, term that's used a lot in rehabilitation, some people take that to the nth degree. They really stretch the plausibility of that. And the reason behind that is because I think people think complexity is better received. I think there is still this problem where over complexity sometimes gives this impression that we are more skilled and we know things better and we're better trained at diagnosis. And I think patients fall for that, but I also think they buy into that as well. And I find that a bit depressing and a bit sad in this day and age, is that we just don't appreciate the simple things in life anymore. Everybody wants, to look at things in way too overcomplicated ways. And it's not saying that these potential hypotheses are not true. They could be true, but what about the other simpler hypotheses that are more likely? And again, I use that old Occam's razor that says, if you can try and keep it simple, it's more likely to be the possible reason as to why things are improving or not, as the case may be.
That is such a great insight. And not to get us too off track, but I feel like I noticed that same tendency in the yoga world. Like with yoga teachers leading students through movement or asanas, there's a tendency to get very overly complicated in like exactly how people should position and, like align the base of your middle finger 1 degree left, and then suddenly the magic happens, or you'll prevent injury. There's that rationale too. So it's just, I think, getting placed on yoga teachers this idea that we need to know a lot and be super complicated in how we're teaching the movement in order for it to be optimal, but I just feel like, just like you said, we can be so much more simple in how we guide movement, and as yoga teachers we can excel in these other parts, aspects of our role as a yoga teacher. It's like such a big picture. It's not just about this one thing.
No, you're right there, Jenny, and it's easy to say, but I do find it's quite hard to do, because us humans, we all have our little biases, and we have our little behavioural habits that can be hard to override, and trying to explain and do things simplistically in this day and age, I do find very challenging. Even for me, who's a fan of it, it can feel awkward, it can feel uncomfortable. And it sometimes does give others the impression that you are dumbing things down and that you are stupid and that you're ignorant. So it takes a bit of practice, it takes a bit of skill to be able to do things simply well and to be able to explain things simply well. But yeah, it's something that I think that us humans, we tend to get that over complexity to hide our inadequacies, our inferiorities, rather than just being happy and comfortable in the simple explanations about things. Yeah.
Absolutely. We've covered a little bit about this idea of weak muscles being like a single factor for causing pain, and kind of countered that idea. Another common narrative that I hear out there is that tight muscles, and we know that tight is this like vague term without a clear scientific definition anyway, but when people say my X part of my body part feels tight, a common response seems to be, well, it's tight because it's weak, so you need to strengthen it. And I feel like for some reason I hear this refer to the hip flexors a lot, but I also hear it all over the body. What do you think about that, tight and strength?
Yeah, again, stiffness is a perception, just like weakness is a perception. And whenever we're dealing with bodily perceptions, we have to recognise they are poorly correlated to actual structural factors. So although, we can feel weak in places, doesn't mean that actually that muscle is weak. And it's the same with stiffness. Just because we feel stiff in an area doesn't actually mean we've got a structural adaptation or a change to the tissue that is stiff. So stiffness can be driven by many, 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 many things, just like weakness can and pain can be. So again, trying to isolate or determine why somebody has some restrictions or is feeling stiff, it's very challenging to do. And, yes, potentially fatigue is a factor, fear is a factor, muscle force output could potentially be a factor, but it isn't to say that they are definitively the only factors. But, I do see this more of a anti-stretch movement occurring a lot recently, which again, I'm not the biggest fan of stretching, if I'm being honest. I don't personally enjoy it. I find it a little bit boring and dull, but I know there's people out there that absolutely love to stretch. They put themselves in positions and they hold it there for 25 minutes and they love it. They love those sensations and those feelings of stretching, and that's great. I think they're moving, they're placing their tissues under some tension. And, who's to say that that's the wrong thing to do? Who's to say that's bad? I'm certainly not going to say that's bad. It's just another way of movement. And, it's better than just sitting sedentary on the couch. So, stretching, I think this anti-stretching paradigm that a lot of people are saying that it's useless, it's a waste of time, I don't agree with it. I think there are other ways of dealing with stiffness than just stretching alone. I don't think it's the only way to help somebody who's got a perception of stiffness. And again, we do see, in the research now that you see comparable effects in sensations of stiffness and improvements in mobility with resistance-based exercises as we do with static stretching. So it's not that one is better than the other. They're just two options that you could use. And I think, which one you decide to use is very much based on the person in front of you. So if I'm dealing with a dancer who feels stiff and wants to improve that sensation of stiffness, yeah, stretching might be the preferred option for them to do. And who's to say that's a bad thing? Not me. But if they've been stretching for 6 months...
Or maybe they've... Yeah.
Yeah, I was going to say, if they've been stretching for 6 months and those perceptions of stiffness hasn't changed, the definition of madness is carrying on doing the same thing and expecting a different result. So if they've been doing that for 6 months and that stiffness is still there and it's a chronic stiffness and they've stretched and stretched and stretched, now I'm going to say to them, well, okay, I know you really like stretching, you value stretching, but it doesn't seem to have made much of a difference. How about we try and find a different approach and a different strategy? which is a challenging conversation to have with dancers, trying to get them to think, to move away from stretching, which they think is the answer to their stiff problems, and focus on other things such as resistance-based exercises is tricky to do. But this is where, again, we need the good communication skills, we need good therapeutic alliance with people that we see for them to, try things that are a little bit different. So I think, it's about having options when it comes to stiffness. It's about playing around with various different approaches. And as I say, if something doesn't feel like it's working, then change tact. But stretching does change people's perceptions of stiffness quite a lot. And if it works and it's positive, crack on, carry on. No problem with that at all.
Travis, did you have a question you were going to ask?
Nope, I was just going to say, if the dancer's been stretching for the last 18 years and they're coming to you with a pain complaint, like, maybe try something else. But, it's the okay, we try the first thing. If the first thing doesn't work, then we try the other thing. It's not, there's never going to be one size fits all that works for everybody.
Nope. And that's the key. It's patient-centered, person-centered care. That's the thing that we're moving more towards now in healthcare, which finally, great. It's good to hear. Moving away from recipes and protocols and lumping people into groups. It's about focusing on the person. It's, being aware that, you've got all these different options you could use, but trying to fit that to the person in front of you based on all these other variables that we've discussed already. That's the way to manage people with pains and problems. It's not just giving everybody a sheet of exercises and saying this is what you need to do for this particular condition. That shit just doesn't work.
The one other thing that we hear a lot, both in all corners of the rehab and fitness and yoga worlds, is this idea that your muscle imbalance is what's causing your pain, and then the recipe for that is correcting the muscle imbalance, doing more pulling exercise than pushing exercises. It's going to it's going to correct the muscle imbalance. It's going to fix your posture. And it's, the recommendation of strengthening or resistance exercise for that, I think we're all on board with. But again, it's that narrative, right? It goes back to, it's the same as the weak muscle. Now it's just comparing the weak muscle to something else. But they're probably not actually measuring anything. They're probably just saying, well, your shoulders are like this, therefore you must be weak in the upper back.
Yeah, again, that's sort of, you're too strong here, you're too weak there, upper cross syndromes, lower cross syndromes, that have been around since Yanda promoted them back in the 90s, in the 80s, all these paradigms have been seen, not to really hold up as explanations as to why people have pain and pathology. We see posture is poorly correlated to problems and pain. It doesn't mean that you can't get positive effects by changing somebody's posture, which is sometimes misinterpreted, but that doesn't mean their posture is a causal factor. I sometimes see people in positions and postures they adopt when they're in pain because of the pain. Doesn't mean that was the cause of their pain. But and again, this approach of muscle imbalances, push-pull ratios is often something I have a discussion with people all the time. They say to me, what's the optimal push-pull ratio? And the first question I ask is, which way are you pushing and pulling? And they look at me like I'm cross-eyed. They're like, what do you mean? I say, well, are we talking push-pulling above, over, vertical or horizontal? There's your first question there. Oh, I haven't thought about that. Well, there you go. That's the first thing to think about. And again, lots of people say, for every pushing exercise, you've got to do 2 pulling exercises to correct these postural asymmetries. I'm like, show me any evidence that shows that has a beneficial effect for anything and on anybody, because I haven't seen it. So I hear these terms used a lot, this bro science, gym talk all the time, and again, it is just talk. There's no data or supporting evidence that it's actually needed or essential for muscle imbalances. Don't even get me started.
The only thing I would say
either.
Oh yeah, it's just like if a person has come in and all they've ever done is bench press and curls, like we could spend some time doing some rows, like that would be okay. But if you're doing a balanced program where you have roughly the same amount of pushing and pulling, and you've been doing that for a while, like you don't suddenly need to read, oh, well, a 3-to-1 ratio is the magic ratio for this. And now I need to, and like the amount to think about what a program would look like where you're actually doing, you know, if you have 10 sets of pushing, you're doing 30 sets of pulling. Like it's so silly, but people just put this number out there. And I see people asking you and others all the time about that. And it's just like somebody just made that number up and they were shouting it louder than everybody else, and now everybody buys it.
Absolutely. You know, I sometimes put it into perspective with other situations as well, because when people say, oh, are you going to develop muscle imbalances if you just do bench press and you don't do enough rows to counteract it? I'm saying, well, do you go jogging? Do you go running? They go, yeah. So which direction do you run in? Well, I run forward. Okay. Are you going to get postural muscle imbalances because you only run forward and you don't do the same amount of backwards running now? And you see their face go, no, because that's stupid. I'm like, well, it's the same principle you're applying to pushing and pulling ratios. Surely, you know, if you're saying, you know, you've got to counteract this, surely if you're going to go running in one direction, you've got to counteract it in the other direction, haven't you? And I know there was a little bit of talk about
careful what you say, though, because then you get people...
I know.
I was going to say, now I'm hearing people backwards running, backwards walking, backwards sled pulling. Not to say that those aren't bad, but it's not, doesn't need to be a 1-to-1, right? And it's pretty obvious. But why don't we see that?
Yeah. And humans are asymmetrical as well. We got to celebrate asymmetry. Yeah. Sorry, Jenny. I think we're just saying the same thing there. We got to celebrate.
We were saying the same thing. Yeah.
Yeah, celebrate asymmetries. Don't demonize it, you know. Say enjoy it, that your body can do some things better on one side than the other, because that's perfectly normal. We very rarely do things symmetrically, you know. We always tend to have that, you know, preferred hand that we go to reach for things, or that leg that we trust more when we step up onto stuff. There's nothing to say that that's dangerous or harmful or bad. Not at all.
Yeah, is that an adaptive thing that we've picked up to facilitate our performance that doesn't necessarily mean that it's bad or something that needs to be corrected?
Yeah, I think it's just that little bit of extra complexity to make us appear, say, that little bit more sexy and a little bit more intelligent, totally unnecessarily, I think. Yeah.
I know that we are about heading toward wrapping up this conversation. I was hoping I could just throw out one last question to you, Adam. Which is just, okay, cool. That I've experienced that in the yoga world, there tends to be this assumption that because someone is a physiotherapist or a physical therapist, they are therefore an authority on the body and on pain. So there's kind of, because they're in the yoga world, you know, there are a lot of people who are yoga teachers, but there are also yoga teachers who are also PTs. And they tend to be, just because they have the PT after their name, everyone is just like, they know what they're talking about. I'm going to trust them. So I'm just wondering if you could maybe conclude.
Adam has his hands on his face right now for those of us who are listening to the audio recording of this.
That's what I was just about to say. If you're not seeing the visual of this, you're probably not seeing my facial expressions as Jenny's talking there. But no, Jenny, this is often something that I see talked or said or claimed a lot about the hierarchical nature of the various different professions and your different training, and it's absolute bollocks. It's absolute nonsense. So, you know, I see people with all the bloody qualifications in all the world. They've been on all the bloody courses. They've done all the postural recorrection stuff. They've done all the exercise physiology courses, and they're rubbish. They're absolute crap. They've got absolutely no idea of how to assess, interact, or deal with things in any sensible way. Yeah, I see people, you know, that are self-taught and have learned through reading and critical thinking. They're absolute masters at it. You know, a name that jumps to mind is Todd Hargrove. You know, Todd Hargrove has had no formal training in any particular profession of the healthcare, but he understands pain.
He's a lawyer.
He's a lawyer by training. But he understands pain and he understands movement, I think, better than I do. He understands it better than I think probably 99% of all healthcare professionals do out there. And he writes beautifully about it. So, you know, somebody like him is, I would class as an authority on pain and movement, yet, you know, no formal qualifications, not even a healthcare professional. So, it just goes to show that I think, trying to rely on qualifications and professional titles alone can sometimes cause problems. Now, I don't want to come across as too disparaging to all of my colleagues and start saying that there is no trust in any of the professions, because I don't think that's true, because I do think, there are people in my profession and in other therapies and in other healthcare professionals that are excellent. But when I see people claiming, this is better than this profession is better than this, don't go to them because this is group of people over here are better. I'm like, I see the good, the bad, the ugly across the board. So it's looking at the individual rather than their actual titles and qualifications, I think is something to be focused on.
Yeah, it's tricky, I think, because as a layperson, you see the letters after somebody's name, and it's easy to kind of assume that they are an authority. And it's not to say that physiotherapy education isn't amazing and isn't several years of really good foundational education on the body. But sometimes it can be outdated, or the person can be having practiced for many, many years and not continued to learn beyond what they learned in their training. And so that's probably the biggest challenge. But then as the layperson, how you identify that person ahead of time, or like you go and do a session with them, and like, how are you supposed to know that they're 20 years behind the times?
It is challenging for people that, as they are, searching for somebody to help them out, and they are relying on obviously CVs and letters behind the name to know again who is good to go and see. And that's where I think sometimes word of mouth and personal recommendations are probably to be trusted in some situations more than others. But again, when it comes to that sort of approach with regards to trying to find that balance between education and experience, I have a saying, again, another saying for you, some people have 10 years experience, some people have 1 year's experience for the last 10 years. And I'd much prefer to have somebody who's got 1 year's experience, and they're changing it, they're updating it every year, and they've got 10 years of doing that, rather than somebody that says, I've got 10 years of experience. Yeah, but if you've stopped updating your experience when you qualified, you're probably out of date. Yeah.
That is a great distinction. Thanks for highlighting that. So just how in whatever year someone did their education, just that it seems like what's important is to continue to evolve and stay current with the research and to adapt as times change. Yeah. Maybe that's probably a good message to leave our listeners with and wrap this conversation up. But Adam, we are so thankful that you took the time to join us and talk to us and have this conversation for the benefit of our community. You shared so many great insights with us. Could you tell our listeners like where you think the best way for people to learn from you and connect with you and follow you?
Yeah, sure. Well, I'll just say thanks for inviting me on again, Jenni and Travis. And I'm fans of what you guys and girls are doing out there as well in the yoga community. So please keep on doing that as well. So kudos to you for trying to enhance and improve things there. So well done. Keep it going. As for trying to follow me or get in contact with me, if anybody wants to, I'm on most of the social medias, so you can come and find me there under Adam Meakins. I'm even on TikTok now as well, although I'm not doing any of that bloody dancing stuff because I'm not into that. I'm on TikTok. I'm not using it. I haven't got to grips with it yet because it's all about doing dances, and that's one thing I haven't got. I've got a bit of strength, but I haven't got coordination. But yeah, if you just find me on Twitter is the social media platform I use the most, but I'm on there under Adam Meakins. I've got my website, the Sports Physio, as well, so you can go and check that out if you want to. And I've got some of my schedules and my courses and stuff on there, and my blogs as well if you want to read those. But thanks very much for your time.
We will link to all of that in the show notes, so you could, any listeners can go there to find Adam. You're also great on
You have a podcast as well?
And you have a podcast.
Oh, yeah. I forgot to mention that. Yeah. Oh, and the other thing I forgot to mention, and Ben will kill me for this because I haven't mentioned that as well. I keep forgetting.
Oh, yeah.
So
Better Clinician Project.
The Better Clinician Project. Me and Ben Cormack have set up an online education community. It's a subscription service, so we're earning a bit of money out of it, but it's very low cost. It's £12 a month, which I'm not quite sure what works out into dollars, but it's probably less than $15 a month, I think. But it's just an online education platform where me and my colleague Ben Cormack promote evidence-based, simple, clear ways and means of looking at various different pathologies and pains and ways of doing rehab. So you get 3 pieces of information every week, say for a small subscription. No contracts, no commitments. You can drop in or out as much as you like, but please come and check out the Better Clinician Project and my podcast with my good friend Greg Lehman as well. Is a monthly podcast we do called the NAF podcast as well. Thanks for reminding me, Travis. I'm terrible at this stuff.
Yes, and Greg was actually a guest on one of our previous episodes, so our listeners know him, so they can imagine what a thrilling listen that is with the two of you.
Right, exactly. Yeah. To listen to the NAP, yeah.
I just tend to throw out obscenities.
So you do. You guys always.
Well, that makes it that's what part of makes it so fun.
Exactly. Thank you so much, Adam. We so appreciated having you today.
Thanks again for the invite, Jenny and Travis. All the best.